Hi everybody and welcome to BPD Update. I'm Steve Strachan. I'm the Chief of Police here in the city of Bremerton, and if you watch our show regularly, you know that this program is about one thing, and that's letting you know what we're doing around the Bremerton Police Department. You've heard me speak a lot, if you watch the show, about mental health and the intersection of mental health and law enforcement, and how many calls we have, how many issues we have related to people suffering from some type of mental illness and going through some sort of crisis related to mental illness. And we talk about it a lot. And this month we have a great guest with us. This is Ellie Carrithers. She is the Director of 24-Hour Services for Kitsap Mental Health Services. Is that right?
You're absolutely right.
First of all, welcome to the show.
Thank you very much.
We're going to talk a little bit about mental health, and what we're going to try and do in the show this month is not just talk about sort of the generic topic of mental health, and you've probably seen a lot of things about that, but to give you real information about what exactly you can do if you or someone in your family or someone you know has issues related to mental health, because frankly we all do. I certainly have mental health issues in my family. I don't know a family that doesn't.
Absolutely.
To whatever level, and when it manifests itself with behaviors that are unsafe, behaviors that are threatening, and sometimes crime, which we deal with all the time, that's where the rubber meets the road. And that's the kind of things that we do in conjunction with Kitsap Mental Health. So again, we're really glad you're here with us, Ellie. People have probably heard about Kitsap Mental Health, KMH. Can you give us just a quick overview of what KMH does and how many people work there, what they do?
Absolutely. So Kitsap Mental Health Services is a private not-for-profit community mental health center, and we're located in East Bremerton. We have a satellite office in Port Orchard, and also another facility, another office on Wheaton Way. And so we provide a full range of mental health and behavioral services for adults, youth, and older adults in Kitsap County. We have over 400 employees. We serve about 6,000 people a year.
Right. One of the things that I'm proud to be a board member of Kitsap Mental Health, and I'm really pleased that I was asked to be part of that. But one of the things that surprised me is it's a big operation. I mean, it's a very large budget. I think it's $30+ million.
Absolutely.
As you mentioned, 400 employees, a tremendous amount of patients. It's the largest provider of mental health services on the peninsula.
It is.
One of the largest even outside that area. I mean, services vary. I mean, some people, it can just be an occasional visit. There's medication. There are people who are actually residential, people who actually are living in facilities managed by Kitsap Mental Health. Is that correct?
Correct, yes.
Can you talk a little bit about that? I mean, I'm assuming that has to do with more extreme cases or more significant cases of mental health. And talk a little bit about, sort of the continuum, I guess, what's the word I'm looking for, the people that have very little contact, maybe medication or counseling, to people that are actually living in residential facilities managed by KMH.
Right. And so we really provide a continuum of care with multiple points of access. And so the residential services that you mentioned, I mean, the reality is that for most people who are experiencing mental illness is that recovery is possible, and that most people receiving services and care are able to reintegrate back into the community and don't need the level of support of having the supported housing, but we do have supported housing for people who are requiring that level of care. And we have over 100 units down in the Bremerton area, just supported housing. And then we also have a residential transitional program, 16-bed residential unit that's on our campus that is a step down from inpatient psychiatric services, but also is helpful for people who need a little bit of extra stabilization and some help with housing.
So in other words, people who are living full-time, receiving full-time treatment, because that's the intensity that they require from their treatment plan.
Right.
So I think it's a little confusing to some people. It's confusing to me sometimes. People with private insurance. I'm fortunate with a full-time job to have private insurance, and in our society, insurance is based upon who you work for, right or wrong. We're now going to ACA, the Affordable Health Care Act. As we go through that change, talk a little bit about, if we have a viewer who's watching and has a son who has mental health issues, a family member, somebody they work with or somebody they know, and they're people that maybe don't have a lot of money, maybe don't have a lot of resources, maybe don't have insurance. How does that work? How do they access resources?
Well, and so accessing resources at Kitsap Mental Health is that we have a 24-hour, first visit walk-in service where they can walk in the door and receive access to services through an assessment and an intake. They can also receive information about other resources in the community if they did have private insurance.
Right.
A lot of people with private insurance actually access mental health care through their primary care physician.
So in other words, KMH is a resource for people with insurance or without. Is that correct?
Mostly for people with Medicaid.
Okay, but when we say Medicaid, that means people that don't have private insurance through their employer. Correct? Okay, but people with private insurance can also use KMH if they choose to, depending on what their private insurance company wants to do. But let's go back to your point about walk-ins. In other words, and again, I think this is important, a person who has a family member who has mental health issues and they don't know what to do and they're at their wits' end and things seem to be getting worse. Sometimes they call us.
Right.
But what I'm hearing you say is that they can go, they don't have to go to the police if they don't want to. They can go straight to Kitsap Mental Health Services and access care. And how do they do that? They can walk in?
They can walk in.
Okay, and
yes.
Walk us, how does that happen?
And so then they can just come into our main lobby and they will be assigned to a screener and an intake person that will help evaluate their individual situation and assign them to an individualized plan of care that's really associated with the needs that they have.
Right, and the hours that they can do that are what?
8 to 5.
8 to 5, so 8 a.m. to 5 p.m.
Well, I'm sorry, 8 to 4 for our access line. Our business hours are 8 to 5.
Okay, so 8 to 4, so specifically 8 a.m. to 4 p.m.
Right.
People can walk into the lobby, and that's at the KMH main office, which is on Elmira Drive.
Right.
And we'll get you that address at the end of the show, get you all the information at the end of the show, so you don't have to remember this. But Elmira Drive, it's in East Bremerton, just behind the Fred Meyer, basically, back up the hill behind the Fred Meyer. So in other words, that's a physical location people can get to on a bus, they can walk, they can drive. They can walk in that place and they can get assessed that day.
Right.
It's not come back in 3 weeks. That's a big deal. That didn't used to exist. So if there's people watching this show and you have a family member or friend that needs that, 8 to 4, there's walk-ins there.
Right.
Now, if the person says, you know what, I'm not working, I don't have insurance, I'm 35 years old, I don't know what to do, they don't understand the system. A lot of people don't understand the insurance system. It's really complex. Tell people what they can do if they don't, how are they going to pay for this?
So our screeners through our access can help people, access funding if it's public funding, and get them, if they're eligible for Medicaid, can help them to access that. And
so what I'm hearing you say is don't worry too much about it.
Right.
We'll figure it out. And so again, I think it's something that a lot of people miss is, they're not going to say, go back out the door, you don't have the money to pay for this, we don't want to talk to you. They'll help you figure it out, whether it be through Medicaid, through other, there's other sources for what's the word I'm looking for, people that don't have insurance. And then there's the ACA.
Yeah.
And the Obamacare, for want of a better phrase. That's been a change, and I know that Joe Rozak, who's the director of KMH, has mentioned to me that walk-ins are way up after ACA has gone into effect because a lot have people have access.
We have 40% more people accessing services for us at this point because of healthcare reform, which we're really delighted about because there always has been a service gap in our community where people kind of fell into the crack and weren't able to access services, and now we're able to meet their needs, and we're really grateful for that.
And is it accurate to say when you talk about the service gap, it wasn't what I would call the poor, it was more kind of what I would call the working poor?
The working poor,
people that are working, maybe they don't have full-time insurance, and it was kind of that donut hole between people with really good insurance and people that were, that really didn't have anything at all but had some access to, this is that people, the folks in the middle, and a huge need.
Yeah,
and again, people that are working and doing the best they can, and if anyone comes away from this show with anything, it's out there. The ACA, whatever you may think of it, is starting to fill that gap, and that's a good thing. And more people accessing mental health care is a good thing for law enforcement, for our community. Talk about something that I've learned since I've been on the board for Kitsap Mental Health is treatment for different types of mental health. I think sometimes in this business we get this, it's sort of like, well, it's always going to be that way, it's never going to be any better, all you're going to do is kind of muddle through and try to manage it. what I'm learning is with medication and treatment, there's some really positive outcomes. Can you talk a little bit about that?
Absolutely, absolutely, and because of that, we're able to offer this continuum of care. You know, we're able to meet people with what they need, and we are able to help them to you know, have an individualized care plan that's going to be able to help them to become stabilized. You know, with whatever they need, which is a wide variety of different types of interventions that are available. Sometimes it's medication management, sometimes it's case management, sometimes it's help with basic needs around housing.
It helps me to understand these things when there's, you know, you talk about systems and care, but can you give me an example of somebody who is in a bad state, having a really hard time getting by day to day, getting involved in things, where there's been a real success based upon some of the things you're talking about?
Yeah, absolutely. I mean, somebody who, I mean, we're able to, you know, meet people who have psychiatric emergencies that are requiring, I mean, they're in a crisis situation where our crisis response team can help evaluate them and get them the treatment that they need. An acute psychiatric crisis, they could come in through our adult inpatient unit potentially and receive care there to become stabilized. And then once that happens, then they would be able to have care through our outpatient providers, and then that will you know, help them to. I mean, our main focus is that, you know, we really want to have people to be integrated into the community, and we know that people are able to you know, to access recovery and be able to you know, return to a level of functioning to where they can be in the community.
And it's very real. And again, you see it all the time. But as somebody who doesn't work completely within that system, I'll be frank with you. I think sometimes the public's perception is driven by popular culture and movies, and, you know, they watch One Flew Over the Cuckoo's Nest and they think, well, people that are on meds are all zombies and they're all, you know, it's just this sort of hopeless, you know, it's never going to get better. It gets way better. Medication is amazing stuff, and particularly the current state of the art is really extraordinary. And people can function at a very, very high level, including people with pretty profound mental health issues. And so the science has really changed, and something that I've learned as a board member over the last couple of years. So again, it's a big deal, and I really want people to understand you can access these services. It makes a huge difference. And not only in terms of the intersection with law enforcement, but just living life and living a productive life and having a family that is functional. So very important stuff. You do really important work. KMH does important work, and we really appreciate it. Most important thing from this presentation today, people watching this saying, okay, that's me. That's me or my family or my friends. We need to access this. Where do they get information, and what specifically do they need to do to get those services? Well,
I think the first thing is just to, and I know you're going to show the phone number at the end too, but just to contact us at 405-4010, and that's a point of contact where they can get the information that they need. And in a crisis situation, then they would call our crisis response team directly, and they would be able to evaluate and help as well.
And if people forget those numbers, they can call 911. They have access to those as well. So it's great to remember those numbers, but if you say, I can't remember that number, I can't find it, 911 is okay. Call 911, tell them that you need to contact Kitsap Mental Health. They'd be happy to help you. Call the police department, would be happy to help you. And again, let's go back again to that 8 to 4, walk-ins during weekdays.
Correct.
Anyone can walk in for an assessment, and they will get an assessment that day.
Correct.
Is that correct?
Yes.
That's a huge deal. Very, very significant. It didn't used to be that way, so I really encourage people to use that resource. As I mentioned, Ms. Carrithers, really important work. It's very important to our community and to our police department. And the things that you do at Kitsap Mental Health are very significant. We thank you for your work, and we thank you for being with us.
Thank you very much.
You bet. Thank you.
Yeah.
And we'll be right back after this with our statistics and a few anecdotes around the Bremerton Police Department. Well, again, many thanks to Ellie Carrithers from Kitsap Mental Health, and we will have that phone number for you again, as well as the website at the end of the show. And again, just a reminder, if you want to access mental health services, you can always call 911. They're happy to get you the number and the information that you need. So in the last half of the show, as we usually do, let's talk a little bit about a few statistics and numbers, and they are illustrative of trends and give you some idea of where things are in our community. And so that's why we offer these to you. So first of all, let's look at the numbers for May, excuse me, May of 2015. And I'm going to show you May from 13, 14, and 15. So for the last 3 years, so you have some idea of where that's going. You can see that reports, and reports are just anything that we have to take a report on. It doesn't necessarily mean crime, just something that gets a report, is down to 883. That was from over 1,000 in May of 2013. The number of arrests also down. Excuse me, we've seen arrests trending downward month to month for the last year, year and a half. Again, generally a good thing. It isn't for want of trying. Our officers are out there very aggressively enforcing the law. But as we start to take out some of those frequent flyers that we keep talking about, those chronic offenders, I think that's bringing some of those arrest numbers down. You can see that domestic violence was up just a little bit from last year, though that's something that really isn't affected by any kind of policy that the public takes. It really has to do with individual situations. And then DUI is also down to 4. We've been seeing DUI arrests trending downward for many, many months. Other departments are seeing the same thing. State Patrol is seeing the same thing for a number of reasons, and I'm not convinced it's because there are fewer drunk drivers. My feeling is that just the resources that departments have, whether it be the Sheriff's Office, the State Patrol, Bremerton PD, are simply not what they used to be. We don't have the traffic unit that we used to have in terms of the number of officers. We don't have the people out patrolling specifically for traffic offenses that we used to have. So you're seeing DUIs trend downward. Not a good thing, but just something we want to share with you. And you can see mental health calls, excuse me, we're at 19 for May of 2015. That's for calls that were specific for mental health as related to involving mental health. So again, that's different than calls involving mental health because a lot of our calls involve mental health. Well, let's go ahead and take a look at what we call the frequent flyer focus areas. And if you watch each month, you'll see that we track these focus areas. And these are the folks that are chronic offenders, are wind-up toys of crime machines that just can't seem to stop, and we have to deal with them in an aggressive way. And if you look at the crimes with which they are involved, let's take a look at those trends as well. In terms of trespassing, over May of the last 3 years, you can see it was up about 4 from last year, but and up actually pretty significantly over May of 13 as well. Our thefts, though, were down a little bit from 2 years ago to 68. Our vehicle thefts were at 9. If you get your car stolen, that's a big deal, but 9 vehicle thefts for a city of our size is not a crazy number. We'd like to see that continue to go down, though. Residential burglary is down significantly from 2 years ago and down from last year to 16. And non-residential burglary also down to 12. Those are good numbers. We want to keep tracking those as well. And vehicle prowling was also down. We saw a real problem with vehicle prowls, especially in the winter months this year. We're seeing that trend downward because, again, I think some of their focus on frequent flyers is helping a little bit, down to 6 for the month of May 2015. DWLS is driving while license suspended. You can see that number was at 5. And then malicious mischief. Malicious mischief is just what it sounds like. Things like vandalism, disorderly conduct, we're at 28 for May of 2015. I'm going to keep talking about numbers if I can for just a minute. Bear with me. The statewide crime statistics for 2014 came out in May, and I want to talk a little bit about that. First of all, the state population for the state of Washington in 2014 was 6.969 million. I think I just read last week in the Seattle Times, it's now just over 7 million. So the state's about 7 million right now. In a state of 7 million, there were 352,000 plus what we call Group A crimes committed. These are sort of the major crimes: robbery, burglary, homicide, assault. You know, those crimes that you think of, it's pretty significant crimes. Crimes against persons in the state, now this is statewide, increased 1.7%. We've been seeing crime trend downward for many years. This is the first time in a while that we've seen crime trending upward, and crimes against persons went up 1.7% in the state of Washington. That's things like murder, rape, and assault. And crimes against property also increased 0.2%. These are crimes against properties, things like robbery, burglary, theft, auto theft, and fraud. So if we're talking about statewide and nationwide statistics, you're seeing those trend a little bit upward. It's not alarming, but it's a little bit up. Domestic violence calls, this is a really interesting statistic to me. In the state of Washington, crimes against persons, and again, robbery, rape, homicide, assault, 51%, over half of all crimes against persons in the state of Washington last year were domestic violence related. And obviously most of those were assault and homicide. When women were killed, it was domestic violence that usually killed them. When women were assaulted, it was on almost every case, not every case, I should say, over half were domestic violence. Domestic violence is a big, big problem nationwide and in the state of Washington. And that number is sobering to me, that 51% of all crimes against persons in the state of Washington were domestic violence related calls. 63 of 171 murders in this state, 37% of our homicides in the state of Washington were domestic violence homicides. And then this last number, again, is one that is a little bit concerning to me. There were 1,209 assaults on police officers in the state of Washington in 2014, an increase of 5.6%. I can tell you anecdotally that we are seeing more people in the midst of the controversy and the issues related to places like Ferguson and the Garner case. People are justifiably upset about that, and we're having some thoughtful conversations about that nationwide. But there's also a group of people that basically are becoming much more confrontational toward police in the midst of that. And so it's something we need to be aware of. So now let's talk about the city of Bremerton and our 2014 crime statistics as they relate to the year before. So first of all, in this slide, you're going to see our homicides. We had 0 in 2014, thankfully. You can see that felony assaults were down 4.3% in our city, and simple assaults were also down 0.2%. No contact order violations. These are judicial orders issued by the court. We deal with those a lot, and those violations were up 17%. So in other words, contempt of court, people not following the court orders are up 17%. But robberies were down 30%. You can see burglaries were down 24%. That's a really good number to see those burglaries trending downward. Theft overall was down 7%. We saw a slight decrease in auto theft. Vandalism was down almost 14%. You can see at the bottom there, prostitution arrests were up 178%. That doesn't mean that we've seen an increase of 178% in prostitution. It means that we are enforcing it at a much higher rate in 2014. Prostitution arrests are exclusively a function of enforcement and us choosing to enforce it and go out and aggressively enforce it. So let's look at the, on this next slide, crime rates in Bremerton in 2014 were down 7.6% compared to the year before. And again, going back to statewide statistics, statewide crime was up. In Bremerton, it was down 7.6% in our city in 2014. They do a formula based on your population to give you a crime rate per 1,000 population. Our crime rate in 2014 was 109.2. So in other words, there's 109.2 crime incidents per 1,000 population. And on our next slide, I just want to give you some context of where that is in relation to other cities around the state that are comparable to us. You can see there that at Bremerton, we had 109.2 crime rate in 2014. The number for Port Orchard, for example, was 123. Shelton was 143. Gig Harbor, a little bit lower at 103. And I'm not going to read these all off to you, but you can see Seattle was roughly the same number as the city of Bremerton. Tacoma was quite a bit higher. You can see that cities like Aberdeen and Longview and Puyallup were significantly higher as well. A lot of cities around us, lower, higher. Again, we can get really attached to statistics and numbers, but it just gives you some context of the crime rate in our city. We've talked a little bit in the media and on this show about the fact that Bremerton, because we're the largest city and we have all the social services in this area, anything that occurs pretty much in the central part of Kitsap County gets attached to Bremerton, even if it's not in our city. We had the two very unfortunate, tragic homicides of toddlers, of young kids, neither of which occurred in the city of Bremerton, but they were nearby, and a lot of people said, well, that occurred in East Bremerton. And so as we talk about all these issues about crime and bad cases that you hear about, I want to just give you some context of what the trends are in our city and what we're doing about it. As we move on, I just want to very briefly mention landlord notifications. We've talked about this before, and this has to do with things like vacant homes and rental homes and how to better manage those through landlords and making sure that they're responsible for what goes on in their properties. Our community relations officer, Joe Sexton, checked up on our database. You know that the city council placed greater restrictions and expectations on landlords and making sure that they're running a safe rental home. They wanted to update the database for our volunteer program. We've talked about BCAPs and our new volunteers with the yellow shirts and uniforms. You're going to start to see them out in the community checking up on vacant homes and some of our rental properties. So we updated our database We're finding that 221 were registered in the landlord notification program. 114 of those remain, so a lot of them came off the database. The rest have either sold, and many of them, this is a good sign, are now owner-occupied. So it used to be rental property or vacant property are becoming owner-occupied. They're getting updated. That's a good thing for our community. And again, our volunteers will be out checking some of those vacant homes as we integrate and start up our volunteer program. Last thing I want to mention before the end of the show is our special operations group. This is our undercover group, the folks that deal with narcotics. Sometimes they're the ones that do our prostitution stings and the John stings. They're the folks that deal with some of the neighborhood issues that come up. We've received neighborhood complaints. They can be sent to us by phone on our website, just talking to officers in some cases. And we've received neighborhood complaints from several different areas in our city. Again, it'll come through the hotline. It'll come through our community relations officer when he does his meetings. And our SOG team, our special operations group, will go out and do consent searches. They'll knock on the door to talk to the owners. They'll try to obtain a search warrant. A lot of different tactics that they'll use to try to deal with problem houses in neighborhoods that are causing issues, whether it be drug sales, drug use, alcohol use, people coming and going and couch surfing, people that are causing problems in the neighborhood. We try to get on top of that. It's not something we can wave our hand and make it go away in a day. But the Special Operations Group works with our patrol officers and with the neighborhood to do something. We've executed a number of these in the last several weeks, doing narcotics search warrants, getting other evidence through search warrants, working with landlords to evict problem tenants. And what's next, as we continue to work on this, is working with the chronic nuisance ordinance. And our community relations officer works with our city attorney to file chronic nuisance ordinances on these problem residences. And then we follow up again with the property owners and the landlords. I say this all the time, it's a marathon, not a sprint. When you have a problem in your neighborhood, you want it to be solved today. With the Constitution and due process and the restrictions we have, of course, that's not going to happen. But as we work through it, we keep at it, and we work with the neighborhood to try to make it a better neighborhood and improve those neighborhoods that are paying attention, because that's what we're all about, and improving neighborhoods is really an important priority for us at the Bremerton Police Department. So a lot of information about mental health, a lot of information about statistics. As always, we just want to make sure you know what we're doing here. One more time, I'm going to give you the number for Kitsap Mental Health. If you want to access or find out more information, the number is 360-405-4010, or just give us a call. We'll be happy to get the number in case you forget it. Good information this week. We appreciate you joining us. We'll see you next time on BPD Update.